Ann, thank you so much for being with us today and taking part of yet another great Women in Tech event. When I was asked to think about great leaders, women that are great leaders in digital health, you were one of the first persons that came to my mind. My mind and my passion has always been more on the access equation of digital health, and namely how it impacts lower and middle income countries where we're still faced with infrastructure challenges as well as a shortage of health workers. And this is what you've been dedicated to. This is what I've been passionate about. So I've had the privilege to actually meet you at some point over the years and working with you on this joint passion of ours. You've been the head of the Novartis Foundation for over 8 years now, and you've dedicated a large part of your energy and your resources, in fact, to leveraging digital technology to overcome inequities in global health. You're a medical doctor originally. You even spent some time consulting in your early years in Africa and other countries. And among the many initiatives that you're involved in digital health, you're also part of the influential Broadband Commission for Sustainable Development, which works actually on overcoming also the digital divide. And you're also part of the advisory board of the Commonwealth Center for Digital Health and many other things. I know you've published as well a lot on the subject. So, Ann, let me begin by asking you, the Novartis Foundation, what puts the foundation actually in a unique position to promote the use of data and digital for improving health in lower and middle income countries? Can you tell us a little bit what, in fact, what projects you've been involved in or that you're currently involved in that sort of fit this equation?
Thanks so much, Florence, for this fantastic introduction. And let me start by saying the inspiration was bi-directional. And when we first met, your passion also inspired me in the field of digital health at the time. And I think, yes, it is a passion, definitely. And at the Novartis Foundation, since I'm here, as you rightly said, already 8 years now, we really want to advance data and digital-driven approaches to improve population health around the world. And in fact, the reason I don't think there's been a more horrible wake-up call than COVID for us all, to realize that all of the health systems, whether it's in high-income or low-income settings, really need to reimagine themselves. They need to get re-engineered from being that reactive care system, waiting for people to get sick before they look at them, to become proactive, predictive, and even ultimately preventive, so that the health system keeps the populations healthy and becomes a true health system. And that is what we have a legacy of trying to achieve in the Novartis Foundation, innovating the way health and care can be delivered. And what better opportunity do we have than the fact that we live in a digital era to do this with technology? So everything we do is in partnership on the ground with local governments. We leave the local authorities in the driver's seat to define their own priorities and then help them solve those priorities, set the targets together, and then we look to solve them together. But everything we do is underpinned with data and digital. And the reason we say data first is because we know if you measure the things you do, you get to better outcomes faster. Everything you measure is very usable then to improve what comes after. So that's one first goal of all of our undertakings. And digital solutions have also underpinned our work, ranging from the more mature solutions, such as providing telehealth services between patients and providers, or even helping providers who are less skilled guide through their patient care by more experienced health providers or specialist providers. And nowadays we are using, for example, artificial intelligence to diagnose the oldest disease we know, leprosy. And we are developing a tool together with our partners of Microsoft, a tool to accelerate diagnosis of leprosy based on images from skin lesions. So we hope to walk these last miles in eliminating the oldest disease we know with the newest technology available. And so we have very different examples of how we use digital to be the glue between patients and health systems, or to be the solution that can really help people get more coordinated care instead of a care that only addresses one disease, for example.
Thank you for that. Yeah, the mention of partnerships, of course, that you mentioned, partnering with the local authorities, but it usually goes much deeper than that, because partnerships are absolutely key in digital health, in the sense that there's so many pieces that have to come together. Thank you for that. So for the last 3 or 4 years, Anne, you've triggered and co-led and co-chaired multiple digital health reports that have been very influential, and you've done this with the Broadband Commission, which has been wonderful. And this last year, you worked specifically on a report that was focused actually on the AI, and you co-chaired this with Microsoft. In fact, the report is called Reimagining Global Health Through AI, the Roadmap to AI Maturity. And congratulations on this really excellent report. Can you tell us a little bit about the main findings of this report? And then one of the things that I'm intrigued about as well is that you worked on this report, of course, prior to the pandemic. So woven into sort of your findings of this report, how did you adjust the scope, of the work on this while it was happening? What was the impact, in fact, of COVID on digital health, and sort of what your vision is on what's going to happen afterwards?
Yeah, thank you for mentioning that, Florence. In fact, we do co-chair the working group on health for the Broadband Commission since a few years. And this last report was really aiming to look at how AI is already having an impact on the health of populations globally. And what we realized was that, in fact, it's having a tremendous impact already, artificial intelligence in health, and not only in health in high-income countries, but also in low and middle income countries. We did a landscape analysis of including more than 300 use cases from both high and low income settings. And we discovered that it's really covering 5 main use cases, not only clinical care, where we most know AI from. So we know that image-based diagnosis for pathologists or dermatologists, for example, or pneumologist is really made much faster and more accurate thanks to artificial intelligence. But the beauty of this landscape was that it also highlighted how AI is driving population health interventions. In fact, AI was the tool that discovered the first unusual cluster of pneumonias in Wuhan. It was faster than humans to detect COVID. So that's an example, but also it can predict where epidemics will further spread and help governments better address that. It can also really accelerate the way new drugs or therapeutic options are discovered and developed, or existing drugs can be repositioned or for other problems. And it also highlighted how much patients are already using AI in the use of chatbots, for example, or in the use of internet-based health services with internet hospitals, health centers, pharmacies, like in China, with one insurance company delivering already 1 billion consultations per day that way. And lastly, AI is tremendously useful to optimize the health system workflow processes. You can automate your staff planning, your supply chain planning. So all of these beautiful use cases were then distilled into a roadmap where we highlighted that there are 6 core areas that countries have to invest in if they want to advance on the path towards maturity and for AI in health. And this is not only about data and infrastructure, but mainly about people and workforce, the capabilities, about the governance systems and regulatory systems, the partnerships. The design has to be needs-based and human-centered, and obviously also the business models. So countries can now self-assess where they should really invest in to benefit from the potential of AI and not be left behind. But as you rightly said, during the whole work we were doing, COVID hit us all. And while the world came to a standstill with COVID, the digital technology world boomed. And we just shifted from one day to another on virtual work, but also in the health setting. And I'm really thrilled by the fact that COVID was the trigger for even the most skeptical ones amongst us health professionals to get us over the line that the benefits for virtual care more than outweigh the risks of virtual care. So I feel it's become more of the new normal, the virtual care, and I definitely hope that that will stay. And on top of that, we saw a lot of the use cases in COVID already during our landscape. We're looking at how you can accelerate diagnosis, use it for triage to know which patients are the most severe ones and really need a more specific follow-up. All of these algorithms work very well and were transferred from one geography to another. We also did that in Brazil, for example, working on the Chinese lung image-based diagnosis with AI and tailor it to the Brazilian data in the University Hospital of São Paulo, where it was immediately used for tens of thousands of lung images across the whole state of São Paulo, with this I don't know, the 16 million people in the city, for example. It was at the epicenter and it was tremendously beneficial, this earlier diagnosis and triage for COVID. So you can see, I hope that trust, because it did create trust in technology and in the artificial intelligence, I hope that trust will stay. And definitely the limelight that telehealth got during COVID, I hope that will stay as well. You remember, maybe Florence, just a small anecdote is that when I was a young doctor working in Africa, I told you that story already. I was dropped by plane in the middle of a guerrilla area as I was an emergency physician, going with my bicycle from village to village, crossing the river, bike on the shoulder, and seeing the patients that people had kept for me who were wounded or sick during the war. And often I came much too late. Obviously, you cannot do that. Now you can do that with a simple phone, you know. If I think about that, how many lives you save that way. It is tremendous. If this can become the normal, we made a huge step forward to become better in health and care delivery.
Yeah. Thank you, Anne, for all this insight. Absolutely, yes. This crisis, I think we had a boost of plus 70% of internet use. So the impact was, of course, way beyond health, but health has seen stupendous digital health progress in a very short time. And I agree with you. I really hope that many of these even policies and legislations that have been sort of relaxed or passed during COVID will be here to stay with us because of the very impact that you've just underlined. So Anne, another thing that I'd like to ask you, we're in this Woman in Tech, forum, and it's just wonderful to have a woman leader like you in digital health to be part of this. But in the context of, again, this event, can you tell us a little bit how you see the role of women in global health? What are the potential challenges? And if you can give us a little bit of your take on that.
Yeah, thank you for that question, Florence. Women in global health are everything, believe me. In fact, 90% of all the health providers are women. Unfortunately, not as many are in leadership positions, and that is the problem. So I think it's about only 10% of global health leaders who are women, while the majority of the health providers and the people who really make the difference are women. So I feel this we really have to change. And moving forward, I hope it will accelerate very, very fast. But in fact, last year, when we were considering that divide between the real providers and then the leaders, we also looked at the women as tech entrepreneurs, and we found that there's a similar thing. So you have much less entrepreneurs that are women in startups than men. And we really wanted to address that. And together with Women in Global Health, who has the same advocacy goal as us in that field, we launched a challenge, the Build Back Better challenge for digital and AI innovation startups. And we specifically targeted women entrepreneurs in low and middle income countries. And Florence, you should have seen this. In a few days, we posted this on social media. In a few days, we had more than 100 applications, 130, I believe. And these were all fabulous examples of really great startups. So then we had a panel of 10 judges, and they brought all these applications through the funnel, and we selected 5 or 8 entrepreneurs to pitch their idea, and then we chose a winner with our jury. And let me say that they were all fabulous, each one of them. It was very hard to choose, but the winner we chose had a really innovative solution, a Nigerian entrepreneur who had developed a simple platform for women in remote, rural, and semi-urban areas to be connected between with the nearest community health worker in their neighborhood, who could then provide them a home-based service for mother and child health care. And the innovation was a platform where a woman could, with a simple USSD code, register herself, pay, and request a visit of the community health worker in her home for a mother or child health problem. And then that USD code was geotagged so that there could be predictive analytics for better disease surveillance. So it could, in the same way, also really monitor the spread of COVID or other diseases in the future. A really fabulous innovation for women entrepreneurs in health, and it was called Clafia. So I would all encourage you to have a look at Clafia's website. They are really fabulous, and they are going for it. It's going to get big soon, I think.
That's amazing, Anne. I didn't know these statistics that you just cited, so that's huge about the sort of inequity at the leadership level of women in global health. So that's certainly a very worthwhile cause, and something that maybe we can focus on also with women in tech here, because that's a lot of progress to be made there, and fantastic. So Anne, we're running out of time. So really, a very sincere thank you for having taken the time to do this and for the wonderful insights. Again, you're a great leader, great woman leader in this digital space. So it's really fantastic that you joined us today. Thank you again, Anne. Until soon.
All thanks to you. It was such a pleasure. And really, thank you very much, and have a good rest of the conference or event. Ciao.